Hello everyone, welcome to Gray Matter, your soon-to-be one-stop shop for all your exam preparation needs. This is another video in the UKMLA Roadmap series, and we're going to be talking about pediatrics today. And the UKMLA Roadmap series is basically where we walk you through the MLA content map if you're going to be sitting for the PLAB or the UKMLA. These are the topics you're going to be tested on, so of course make sure you take a look at this. And for IMGs, you need to make sure that you pay close attention because I'll be telling you all the newer stuff that you need to look out for in your preparation, because previously in the PLAB blueprint you may not have seen it, or maybe previously in PLAB 1 or PLAB 2 exams you may not have seen these topics. So make sure you keep your eyes and ears peeled, and people who are going to sit for the UKMLA exam, just make sure you pay attention because all of this is important for your exam as well. So child health. To begin with, acute kidney injury. This usually shows up as a scenario where a child has dehydration, diarrhea. Eventually, they aren't passing a lot of urine, right? They get acute kidney injury, right? They'll give you some kind of investigations, and you will have to diagnose the patient with acute kidney injury. This has shown up previously in exams as well. It is an important topic. Prepare it well. Next, you have anemia. Anemia may show up in children with celiac disease, maybe some kind of malnutrition, right? Malabsorption, dietary problems where they aren't getting enough iron or some kind of vitamin. So anemia, right? Important topic, has shown up in the past, usually shows up with malnutrition or malabsorption. Next, you have anaphylaxis. Again, a very important topic. Make sure you know how anaphylaxis will present. This is usually where a child has been given a drug they're allergic to, an antibiotic they're allergic to, penicillin usually, or a child has ingested a food that they're allergic to. This is how this shows up usually. Less so in the case of blood transfusions. I would say that's more of an adult scenario. And anaphylaxis usually comes along with EpiPens, right? So maybe you'll have to explain and how to use an EpiPen to a child's parent. So yeah, anaphylaxis has shown up as emergency scenarios, as parent counseling scenarios. So yeah, make sure you prepare this well. Appendicitis, learn how to examine the abdomen for appendicitis. Very important. Rebound tenderness, learn how to diagnose this and how to manage this. Asthma, very, very favorite topic when it comes to pediatrics. Learn all the guidelines about how to treat asthma, what you need to prescribe, what you start with and what you go to, the escalation of the treatment, and how to use inhalers, all that good stuff, right? Asthma diary, all those things, right? Asthma is very, very important when it comes to pediatric scenarios. Very commonly tested topic. Atopic dermatitis and eczema. Learn all the topical ointments and medication that you can give, okay? So topical emollients, topical ointments, and then the steroids, okay? So make sure you know how to diagnose this and how to treat this. This does show up in exams and has shown up previously as well. Attention deficit hyperactivity disorder, again, a favorite scenario when it comes to child mental health, and it's usually a child who isn't paying attention in school, who's walking around, who can't sit still, and yeah, very important scenario. Autism spectrum disorder, since it's a spectrum disorder, it may show up as full-blown autism, where a child isn't speaking, a child isn't receptive, or doesn't respond to physical affection, or has some kind of developmental delays with their speech in particular, or a child has a very mild form of autism. So make sure you know the full spectrum and how to diagnose this and how to counsel a parent when a child is diagnosed with autism. Biliary atresia, jaundice is very, very important when it comes to children. So make sure you know all the causes of jaundice, or at least all the important causes of jaundice when it comes to children. One of them is biliary atresia. Very, very important. Make sure you do this well. Has shown up in the past. Bronchiectasis, bronchiolitis. All right, foul-smelling sputum in the case of bronchiectasis. You've got your bronchiolitis. Now make sure you do these lower respiratory tract infections or conditions very well, because you need to know how to differentiate these and how to diagnose a child and how to manage a child. Okay, so these might show up and you'll just have to diagnose the patient from scratch. Next, you have candidiasis. This usually shows up with the asthma scenarios where a patient is taking a steroid inhaler and they have oral thrush. So you need to advise the parent on oral hygiene, right? Rinsing their mouth when they're using steroid inhalers, right? Next, you have cardiac arrest, right? This hasn't shown up in, I would say, pediatric scenarios in the past, so make sure you do this well. Learn child CPR, learn how to do CPR in a child, in a neonate, okay? Next, you have cellulitis. I haven't seen this show up in children as much, so make sure you know what antibiotics you're going to give, how you're going to diagnose this case, if you're going to admit or not, okay? Cerebral palsy and hypoxic ischemic encephalopathy. This, I would say, has been tested in MCQs, but I haven't seen it show up in OSCE exams as much. So make sure you know how to examine a patient with cerebral palsy, how to come to a diagnosis, how to counsel a parent. Next, you have chronic kidney. So with all of these pediatric scenarios, make sure that you know how to explain these things in simple language and how to explain these things in a very soft and gentle way, because you're probably going to have to counsel a parent when you have these conditions in your stations, okay? Next, you have chronic kidney disease. This hasn't shown up as much as acute kidney injury, so IMGs, make sure you prepare this well, I would say. They could ask you MCQs, I guess, but OSCE exams, I'm not sure how they'll bring this up, probably give you some investigations. But yeah, this is more of an adult scenario, I'd say. But do it in the context of pediatrics. Next, you have celiac disease. This usually shows up with anemia, I would say. Again, diarrhea, dehydration, right? Make sure you do this well. Family history, right? This does show up and has shown up in the past. Conjunctivitis has shown up in the past. Make sure you look at pictures of conjunctivitis. You know what conjunctivitis looks like because they'll usually give you a picture. Next, you have constipation. Again, very important when it comes to children. Know all the different treatments, and it is common in children, so it might show up in an OSCE exam. Next, you have croup, right? This usually does show up in MCQs. I haven't seen this in OSCE stations as much, but know how to manage this, whooping cough and all. Next, you have Cushing syndrome. Usually, you're given a bunch of investigations and some history, and then you have to diagnose a patient with Cushing syndrome. Make sure you do this well. This could show up in MCQs or your OSCE, very important, has shown up in the past as well. Next, you have cystic fibrosis. I would say this is important. When it comes to pediatric cystic fibrosis, very important topic. They love to test you on this, whether it's an MCQ, whether it's an OSCE station, whether it's counseling a parent, very important. Dehydration. Okay, so with children, you've got the mnemonic PAM good, right? P for pneumonia, lower respiratory tract infections. A for ASOM, acute suppurative otitis media. M for meningitis, G for gastrointestinal problems, U for urinary problems, and D for dehydration and developmental delays. So that's the mnemonic you want to keep in mind when it comes to children. These are very important things. Developmental delay, dehydration, dry skin, right? Dry mouth, lethargy, with dehydration, reduced urine output, reduced number of nappies you have to change in a day, developmental delay. The child may not be speaking, may not be walking. Why it happens. Another very favorite scenario is where you have to teach a nurse or a medical student about toddler milestones. So make sure you know a child's milestones. You need to make sure you know how to assess a child for their development, okay? Diabetic ketoacidosis shows up with diabetes mellitus in children. Very, very, very important, right? Shows up as an emergency case, an emergency scenario. Need to know how to manage this. Commonly shows up in exams, has shown up in the past. Disseminated intravascular coagulation, DIC. I haven't seen this show up in PLAB 2 that much, or PLAB 1 in the context of children. Make sure you do this well. IMGs, okay. Next, you have Down syndrome. Make sure this is usually tested in MCQs a lot. I haven't seen it show up in OSCEs as much, but make sure you do Down syndrome well. You know, learn all the different presentations, all the different characteristics of Down syndrome, okay, and also genetic counseling, okay, may show up as genetic counseling or counseling in parents where they may, a mother has come in and they've had a scan and their child has Down syndrome, right? So, you know, do this well. Next, you have drug overdose. This may be a scenario where a teenager has overdosed on COCPs because they think they're pregnant. Or this may be a scenario where a child has found a bottle of paracetamol and has overdosed on that. Okay, so emergency scenario, important, has shown up in the past. Eating disorders, bulimia, anorexia usually shows up in teenagers. The teenager comes in with their parent, right? Very important. Eating disorder clinic, how to manage it, all that good stuff. Very important, has shown up in the past. Epididymitis and orchitis in children usually shows up with mumps, okay? So you need to know about the infertility complication and how to manage this in that way. Epiglottitis hasn't shown up in the past as much in OSCE exams, or even MCQs, I would say. So do this well. It is an important topic. Epilepsy, first presentation, or other than first presentation, of course, could be a follow-up. So make sure you do this well. Febrile convulsions, a part of the seizures. So seizures in general, epilepsy, all that is important when it comes to children. Gastroesophageal reflux disease in the context of pediatrics is something that's newer, I would say, so make sure you learn that. Phenolphthalein purpura, make sure you look at pictures on the back of the buttocks and thighs. You have the purpura, right, little spots. Do this well. Is tested commonly in MCQs. Gastroesophageal reflux disease as well, but make sure you know how to manage this in terms of the OSCE. Hepatitis, again, one of the causes of jaundice, very important. Hernias in children, make sure you learn that well. I would say more of a newer topic. I haven't seen this in the context of pediatrics as much. Herpes simplex virus, important human papilloma of herpes simplex, mother to child transmission. Make sure you do these well. It is tested in MCQs extensively, may show up in your OSCE exams. They may show you a picture as well. Hypoglycemia shows up with diabetes, hyposplenism, and splenectomy. Do this well. I would say this hasn't shown up as much in the past. Hypothyroidism in the context of pediatrics is important. Shows up in adult scenarios, but make sure you do it in the context of pediatrics. Idiopathic arthritis, again, newer thing. Do this well. Impetigo has shown up a lot in the past. They love to show you honey-crested lesions. Make sure you take a look at the pictures. Inflammatory bowel disease, Crohn's, ulcerative colitis. That is important, of course. Make sure you know how to diagnose these, how to manage these. Malnutrition, malabsorption, important in the case of children. Influenza, flu shots, right? Learn about that. This has shown up in the past, I would say. Intestinal obstruction and ileus. I would say this has shown up in the past where a child brings their knees up to their tummy, right? Flexes their legs, brings their legs up to their tummy, and is crying. So it may show up as an emergency scenario as well. This is important, has shown up in the past as well. Intussusception, current jelly stools, target sign on the ultrasound, tested extensively in multiple choice questions, may also come as an OSCE station. Now, there are a bunch of topics in pediatrics, so I'm going to do it in the next video. We have covered it up till this point. I've told you all the newer stuff for PLAB candidates, okay, and UKMLA candidates. I've kind of given you a rundown of how these topics may come up in your exam. Wait for the next video or look at the next video to look at all the other topics.